Hi, I'm Gary Bebow, CEO of White River Health System, and this is my April CEO Connection. And today I'm really pleased to have my guest, Dr. Bennett Rudorfer, who's been with us since early January of 2018. He's a cardiologist and works at WRHS Cardiology Clinic out at the White River Diagnostic Clinic. And so, Doc, I'm really pleased to have you here, and tell me a little bit about your background and what you want to specialize in cardiology.
Well, I was trained in New York, and I've been down in the Mid-South area for 25 years. We lived in Memphis, and I have 3 kids born in Memphis and 3 in New York City, Midtown Manhattan. I'm an interventional cardiologist, and that's what I'll be practicing here in White River, along with general diagnostic cardiology as well.
Mm-hmm. So, for a person to get an appointment with you, do you do that based on referrals, or can people call and make an appointment themselves?
Both. Most of the time people either come to me by a referral, or they want to be seen and they just call the office and make an appointment, or we unfortunately may have to see them in the hospital, depending upon the circumstance.
That's the 262-1600, that's the phone number out there?
That's correct.
They can make your appointment. So you work out there with Dr. Kirkendall,
yes.
Dr. Stoy,
Right.
Stoyaglu,
Dr. Boyke.
Dr. Boyke, oh sure,
Right.
sure. So you got a whole group of cardiologists out there.
Oh yeah, along with internists. It's a nice office facility. There's a big, lot of space there.
Previously, you worked in Memphis,
Right.
and so comparatively to Memphis, where you worked at White River Medical Center, is a bit smaller. What drew you to come into rural Arkansas to practice?
Well, actually, I had been in West Memphis, so that's rural Arkansas as well. I've been there for 25 years. My practice really straddled the Mississippi River. But it seemed like there was a nice opportunity here and a need, and I'm happy to come and participate.
You know, one of the things that's always impressed me about our specialists at White River is their willingness to go to other locations and see patients rather than have those patients always come into Batesville. And you hold some satellite clinics too, don't you? Where all are you? Where all do you go?
Well, we're going to Melbourne, and actually I'll be there tomorrow. And we're going to Newport once a month. We go to Melbourne twice a month, and Heber Springs once a month, all on Wednesdays. And we're looking to see patients there. You know, it's been a pretty good response so far.
And for a patient in those locations to see, they can either call the clinic directly, or I guess preferably you'd prefer that they call 870-262-1600, and that all can work out that way. So
yeah, if they call the main number, then everything gets put together easily, but they can certainly call the local clinic.
Great. You know, it's always been impressed to me that, as I said, that physicians will travel to those locations. I appreciate your willingness to do that.
Oh yeah,
so,
it's great.
So I really appreciate you coming to work at White River Medical Center. I know you're going to be wildly successful here, and look forward to working with you.
Well, I've enjoyed it so far. It really, it's been busy, and I've enjoyed it.
Well, thanks for coming and visiting us today.
Thank you.
I have 2 employees to recognize for Employees of the Month for April. At Stone County Medical Center, Robin Stone has been selected. Robin's an RN and has worked at Stone County Medical Center for some 6 years, and she's really known well for being willing to float from one location to another, and really the staff up there really appreciates that flexibility. At White River Medical Center, Jenny Callahan, an RN oncology nurse in the navigator role, has been selected for demeanor. She's been with White River Medical Center for almost 2 years. I want to welcome new providers to the White River Health System. John Carter is an APRN who will be working in our emergency department at White River Medical Center. And Vanessa Falwell, APRN, will be our nurse provider at the Tuckerman Medical Clinic. In addition, Deborah Jankowski has been appointed as the White River Medical Center Surgery Director. So if you see John, Vanessa, or Deborah, be sure to welcome them to the health system. Recently, the Chartist Center for Rural Health named White River Medical Center as one of the top 100 rural and community hospitals in 2018. You know, along with our 4-star rating, we've received some really good acknowledgement of the good work we're doing here, and so I really appreciate everybody's efforts. that have made those recognitions possible. So congratulations. By now, employees should have received their packets for the health insurance dependent audit. The packet will come in an envelope from CoreSource, and there's a deadline for to complete the audit by April 6th. So if you have any questions regarding that, be sure to contact CoreSource at 866-434-1211. This is a really important part of our process to make sure that we're covering everyone that we should be, and also we're not covering under our health insurance those that don't meet the criteria. So when you get that packet, be sure to complete it and send in right away. The employee engagement survey has been underway for the last couple of months, and we have almost 700 employees respond to the survey. Once those results have been tabulated, the information will be distributed to all the employees, and look forward to receiving the feedback at your department levels. We really appreciate the time you've taken to complete those surveys, and we're going to use your feedback as a way to make White River Health System a better place to work. So thanks a lot for your participation. For the last several months, the Berkeley Research Group has been conducting an organizational assessment. The recommendations are being completed right now and will be a part of the White River Health System annual board retreat, which will be the end of March, beginning of April of this year. Once the White River Health System board has completed their review of the recommendations, we'll be implementing them, and as it applies to your department, we'll be talking about it at your location. So the good news that we're finding is that, first of all, that White River Health System is really a well-run organization. But there's also some good news in that there's ways that we can even get better. And all that's really important to make our organization viable going forward, and being able to retain our independence. And so I think you'll be really pleased with the results of the BRG assessment, and I'm really looking forward to implementing those recommendations. So more to come as that project is completed. Each year, White River Health System has a White River Health System fishing tournament. This year, it'll be at Norfolk Lake, and it'll be on April the 28th. The coordination of the event is done by our White River Health System maintenance department, and so if you're interested in participating in that, be sure to contact Brandon Langle or Bobby Littleton and to find out more about it. So based upon all my reports from previous fishing tournaments, it's really a great day, and so those of you that do fish, be sure to participate and enjoy the camaraderie of your peers. So that concludes my CEO Connection for April. Thanks for all you do for us, and have a great month.